We're walking to the offices of Tara Mack. We're being told that we're going to have to pull her off the floor. There goes Adele from Apple Valley. Trying to get Tara Mack. We're going to have to pull Tara Mack off the floor. Were you able to do that?
Yes. One of the sergeant-at-arms went and talked to her, and she's coming. She's involved in a conversation right now, but she is definitely going to be on her way.
Great.
Hang out for a couple more minutes.
I'm here to support GAMC, and part of why I'm here is because I'm already seeing patients. I saw one patient in the hospital who was there for back surgery, and he was saying that after he was out, he had gotten really great care in the hospital, and when he was done with that surgery, he was going to be bankrupt, and he didn't know what to do after that. And when you have somebody tell you that story, it really moves you, and that's why I'm here, is to tell his story and try and get some support for the program that can help him out.
I'm a physician with Health Partners, and Health Partners runs the emergency room over at Regions Hospital. Regions Hospital stands to lose millions and millions of dollars because of the charity care that it provides, and I cannot imagine that emergency room staying open for St. Paul, the Twin Cities, outstate Minnesota with its trauma care center, if General Medical Assistance goes away for its support for health care, and have that hospital having to subsidize all the care for the people.
I just retired and moved to Minnesota with the understanding that it was one of the most progressive states in the country. And I also then became aware that we've benefited one of the most from the economic upturn in the preceding 2 decades. We have a very, very high standard of living and income. Now, my belief is that just because the economy tanks, we don't have the right to take away coverage from the people who weren't able to benefit from that. We owe it to those people to maintain our health care status because they are citizens of the state.
Like I said, I was in this car accident on Cedar, and what happened is by no fault, I'm sure you're aware, you get $20,000 in medical coverage. My car insurance company sent me to a quote-unquote independent medical exam just so they could cut me off of the benefits that I'm due by my auto policy, that we're all due through no fault. Under a doctor's orders to not work, and soccer coaching being the only work I could get approved by my doctor, I really didn't know what to do. I went from darkness to sunshine because of GAMC.
My name is Michael Christensen, and I live right by the Redwood Pool in Apple Valley. And my concern, I'm on Minnesota Care. I've been unemployed for over a year. And my concern is once the governor, if he does get his way and we lose this, he intends to pick up the funding using Minnesota Care. And that's going to put a drain on Minnesota Care. So in a secondary manner, I'm going to be at risk. Not to mention all the people that are going to lose that benefit of GAMC. So my position is, please, do the right thing.
Will you support a legislative solution for this?
Yeah, well, this afternoon we're going to be in committee, as I'm sure you know, and there are 2 different proposals moving forward. I've been combing through both of those bills yesterday and today, and we're going to be hearing testimony. I don't know if you guys are going to be in there or not.
Some of us are.
But there are some very viable solutions. We've got 2 different possibilities. Both of them revamp GAMC in one way or another, and I think that they both got possibilities. I think people are looking at compromises to bring in ideas from both. So I don't know what that final piece of legislation is going to look like. And when I do know what that looks like, I'll be able to see exactly whether it comes on the hospitals or who's going to pay. But I'm hoping that a better product comes out of this. And it can't be about program preservation. It's got to be about people and what's best for the people. It's not about this 4-letter acronym. It's about putting something together that's going to meet the needs of the people who need it most. And that's my priority, and that's what I'm committed to.